Mike, we've seen MediTeddi work with people of all ages, the elderly, middle-aged, and kids as well. Kids seem to really like MediTeddi. I don't know if you've had many experiences with children that have had trouble taking their medicines on a regular basis and what the consequences of that have been.
I've seen kids end up in the emergency room with seizures who weren't being given their anti-epileptic medication regularly.
Yeah.
So with seizure disorder, you seeing the same?
Oh yeah, yeah.
So the child could suffer severe consequences of a seizure. It can be fatal. I've seen the same with asthmatics. There are kids who have asthma who stop taking their inhalers regularly. They might be 12, 13, 14, able to do it, but unwilling to do so, not realizing the consequences. So they end up in the emergency room with bad asthma attacks.
Seeing that.
Thankfully, kids don't generally take as many chronic medications as adults do, but those are probably two of the more important ones. And the other thing that I see a lot of is non-compliance with depression meds, with schizophrenia meds, with adolescents and young adults. They don't often believe that they have a problem. They don't really think that they're depressed or anxious. They stop taking their medication and get back into the same troubles with relationships, with their own internal mood state that they were in before they started taking the pill. And oftentimes with depression and mood disorders, the pills will help you to feel better, and then you think it's gone, and because you're a young person, you think you're Superman, nothing will ever hurt you. But when they relapse and come back with symptoms because they stopped the pill, then they realize that it is something they should take seriously, and MediTeddi would be a good reminder,
Yeah, well, we've seen that with MediTeddi. Children feel that MediTeddi is a friend of theirs or a companion, and with that companionship, they're much more likely to go ahead and take the medicine that MediTeddi wants them to take, rather than their parents trying to force them to take. So, and I think maybe it overcomes that feeling that I'm feeling just fine, I don't need to take the medicine, but with encouragement from MediTeddi, they just get them over the hump to take that medicine. So
you'd be like the doctor's voice in their house.
Yes.
Once or twice a day.
Maybe a little friendlier than
a little friendlier. You probably prefer the MediTeddi to us, I'm sure.
Yes. We sometimes as doctors can be a little forceful or dictatorial, and sometimes frustrated because people aren't taking their medicine.
Oh yes.
MediTeddi doesn't get frustrated. MediTeddi's happy all the time.
That's right.
That's a good one.